We are very excited to be here for the University of Michigan Depression on College Campuses Conference. We are excited to be invited. My name is Sofia Pertuz, and I'm the Chief Diversity and Inclusion Officer and Senior Advisor at the JED Foundation, which we'll tell you about more in a moment. I'll let Jan introduce herself.
And I'm Jan Collins-Eaglin, and I'm one of the Senior Advisors at the Steve Fund. And I look forward to working with you, and you'll learn more about our roles as we move along.
So we have two different missions for our organizations, but the alignment that we have is making sure that we are protecting the emotional health and preventing suicide for our nation's teens and young adults. And the JED Foundation, that's exactly our mission. We partner with high schools and colleges to strengthen their mental health, substance misuse, and suicide prevention programs and systems.
And the Steve Fund is a nonprofit organization that really focuses on advocacy and working to promote equity in mental health for BIPOC students, for families, young people, and understanding and building strategies and recommendations. Our website has all of our resources on there, webinars, our Steve Fund Task Force report, and documents that was mentioned at the opening session, and also ways to connect with us in terms of workshops, consulting, and getting involved.
And some of you may be familiar with the JED Foundation. We, like I said, are here to protect emotional health and prevent suicide for young people, and we do that through systems change. We work with high schools and higher education. You may be familiar with the JED Campus program. Maybe some of you are part of the JED Campus cohort of schools. And we work very closely with a team of a comprehensive approach with teams across campus to think about the ways that you provide mental health support and well-being programming for your students. So if you want to learn more, you can go to www.jedfoundation.org. So again, we're excited to be here. A quick agenda, what we're going to do. We already told you about the background of the Steve Fund and the JED Foundation partnership, and we'll share more about how we got together to do a 2-year pilot implementation of the Equity and Mental Health Framework, which we also had collaborated on and created back in 2017. It was when it was sent out to the world. We spent 2 years, like I said, with 18 schools who joined us on a journey to look at their systems and consider their supports for students of color. At the time, that's the language that we started with. So if you look at the Equity and Mental Framework now and the toolkit, you'll see that students of color, but we do recognize that in the last year, especially, we've been updating to use the word BIPOC, Black, Indigenous, and people of color to refer to populations of students of color. But really, the Equity Mental Framework is also meant to be available for other vulnerable communities. So when you see it, we're going to go over it and discuss some of the learnings and some of the outcomes from our pilot implementation. We're also going to walk you through an activity so that as you think about those 10 recommendations, how can you implement them on your campus? What are some things to think about? And I'm in the mindset that you can start anywhere as long as the intention is there to really create safer and more welcoming environments for all students, and especially for students of color. And then we'll debrief and we'll do a Q&A. But we also want you all to ask questions throughout.
Yes, and I would also like to welcome, we have some schools that are represented that are part of our pilot. And so I'd like to welcome them to this presentation. Yay, thank you for joining us. And if you would like to share as we go along, please feel free to do so.
Oh, thank you for that. I did see Dr. Kenlana Ferguson earlier in one of the sessions. So thank you so much. If you are here, please identify yourself, write in the chat, say hi. And if you want to speak up, we certainly would love to hear from you. So thank you for that, Jan.
Yeah.
I was remiss to not include that. So I said this earlier, if you're just joining us, please download this action planning activity worksheet. We create it based on the 10 recommendations in the Equity Mental Health Framework. So I will keep putting it in the chat so that it's easy to access. If you don't have access to it, try logging in with a Gmail account and you'll be able to see it. But anyone with the link should be able to open it.
Also, the actual worksheet will be described in the PowerPoint presentation itself. And so you will get the presentation and we'll walk through it. So no anxiety allowed on this workshop, none at all. Just take a deep breath and enjoy it. Okay.
And this is our way of making this as interactive as possible. We know we're spending an hour and a half together. And if we were in person, what we would have done is, gather you in smaller groups to have discussions. So we're hoping that you will be willing to chime in, raise your hand to go ahead and speak, or put some comments and thoughts in the chat while you're doing the activity in a little while. So thank you for your participation. We're excited. So what we'll begin with is the national higher education landscape. As we know, there has been for many years increase in bias and hate incidents on campuses. Anti-Semitism is up. Violence and hate against Asian and Asian American and Pacific Islander populations is up. Obviously, we've watched the media, and there are challenges to institutional leadership to respond and to chime in and to share their own thoughts about what's happening. So students' protests and demands are just that, just asking for some kind of recognition that racial trauma from the negative media exposure is a thing, that it's real, and that there needs to be a coordinated campus response and better support systems that are acknowledging what those the mental health impact of what we're seeing. And then of course there's the COVID impact, which as we know, we're still in the middle of, and we're hoping we can see on the other side of this something more positive. But for now, this is what we have. And mental health is definitely something that we need to look at. But for diverse student populations, it is especially acute at this time. So I'm going to turn it over to Dr. Collins-Eaglin.
Thank you. So I'm going to summarize this, but I want to preface this slide by saying we just heard in the opening session, and then also there was a session prior to this that really digs deep into these, the picture that we see here, the increase in anxiety, the increase in depression for our minoritized, our students of color, our BIPOC students, and students that feel marginalized. In the previous workshop, they talked about, and this is something that I would like for us to think about that's not reflected in the slides, but is a part of this higher anxiety and depression, that many of the students who of our Black, Latinx, Asian American students, Native American students, our LGBTQ plus students have been impacted in a disproportionate way by COVID, and have family members that have been impacted by COVID. And what does that mean for these students coming back to school, the transition back? What is that racialized trauma? What is that trauma that they're coming back with? And grief, and all of those pieces coming back and having to concentrate in a classroom, in a course, and trying to succeed. And so those are the kinds of pieces that we're going to talk a little bit about, that a framework to really address those issues. And so the anxiety and depression spike for Black and Asian American students after the police killing of George Floyd is very significant. And just thinking about this now, that our students will be reliving some of this as the George Floyd trial begins. And so what does that mean? And how does that trauma and that secondary trauma and the trauma that keeps happening again and again, as you see pictures of this and as you begin to think about all these killings, how does this impact our students that we see? How does this impact their academics and Dr. Abbasi said at the opening panel, it's all about mental health, and it is about mental health. And so that's what we're going to discuss with you. Next slide. So the college experience is this is 1 + 1, this is the consequence, that this is the 2, that the college experience is rated less favorably by students of color when you have all of the external forces and the internal reaction to that. What happens with your college experience? What happens with the courses that you are taking? What does that mean? So the overall college experience for white students is pretty good. In fact, it's above the mean. It is an 80%, as opposed to our students of color. And we see that if we ask about, is the campus safe? Is that campus safe? Have you experienced or witnessed racist actions or discriminatory behavior? Our students have. And so, is our campus safe? What does it mean for campus police? So we'll talk about that. Is the campus inclusive? And our students of color are saying, no, it's not. And they often feel isolated on campus. There's the loneliness measure that was mentioned, and our students are feeling lonely and isolated. Next slide. And so the equity and mental health framework really is taking into account and really looking at what are those factors that really impact our students of color and impact them being successful in achieving their goals academically and professionally as they move to the workplace. And so a joint effort between the JED Foundation and the Steve Foundation was to put together and to study and analyze and to come up with some recommendations and a framework around which will campuses can think about their systems. And so this is a framework to think about how do you make transformative decisions and develop programs on campus based on data and based on what we understand our students of color need. And so we talk about that this equity and mental health framework is not a one-size-fits-all approach. And you're going to experience that in just a short while, how this really is an approach that each campus has to dig in and look at and think about what are my students saying? What is it that we as a campus need to do? And how do we promote positive mental health, prevent suicide, address what are those major stressors that will lead a student to the increase in suicidal ideation, the increase of anxiety and depression. So this is a model that each campus can tailor to its own data, to its own students, to what it means. And again, the focus is on systematic transformational change. This is not just for counseling centers. This is not just for the psych department. This is for the campus to get a handle on what are those transformational changes that are needed, that are system-wide. Okay. So how did we build the equity and mental health framework? What we did is to look at, we're talking about inputs, and so what is the background literature? What is the relevant literature? And what is it that we need to be aware of? And to look at surveys that were given. What is the expert input? What are those experts out in the field saying? And then what do we know about that we've learned from national convenings? And looking at, if you think about this as a logic model, those inputs, those combined inputs led to the study, analysis, and the development and launching in 2017, the Equity and Mental Health Framework with 10 goals. And the purpose of this is to support our college leaders, to support institutions in making mental health a priority for students of color, for our BIPOC students, our minoritized and affinity groups.
And these are the 10. We're going to be going over them in detail, so we're not going to call them out all here right now. But we did just want to say that so we did a pilot with 18 schools, as we mentioned, and part of it was to raise awareness, to urge action towards adopting mental health services targeted to the needs of students identifying as Black, Indigenous, and people of color, BIPOC students. We wanted to show how the strategies within the 10 recommendations might work. We wanted to see, how does that actually look when you're trying to think of any framework? You know, in theory, everything seems like it's gonna be pretty straightforward, or there's a plan. And if you look at the Equity Mental Health Framework and the toolkit, there's some amazing ideas, excellent work that's already happening. Some of it is just enhancing the work that's already happening and amplifying the relationships across campus that are happening to collaborate, to ensure that students don't fall through the cracks, that there isn't that there's a way that campus communities can come together to really be supportive, but in a way that feels more administrative in nature in terms of a structure and decision making. And we'll tell you what we found along the way, but we wanted to elevate the capacity of the EMHF to support school policies and program changes so that they have something to point to that says, these are some ideas, but this came from research. This is what students were telling us. This is what administrators who reviewed this program and these recommendations with us told us could work. And if you do as much as possible from the 10 recommendations, you really can create that stronger environment on campus. And I want to recognize a comment here where someone said a recent and very insightful presentation at a local school board talking to children about anti-Black racism, including an important point of not calling this is probably from our comment before, but don't call it the George Floyd trial. I agree that language is everything, and I think we do need to watch the way we speak about things. So we learned a lot through this process about the way language happens and the way campuses have been responding or not to national incidents still. So it's not stopping. There's a lot happening, unfortunately, but we think that response is really important, and to do it in a coordinated way was the most important thing that we found. These were the 18 schools that joined us on this journey. If any of you see yourselves here, please again say hi. If you're just joining us, there's a link in the chat with a activity that we're going to be doing soon. But we wanted to share, what was it like to do this for the past 2 years? We started out recruiting schools. Some of them were from our JET campus program. Some were working with the Steve Fund in other capacities. But we started with just, what are the Equity and Mental Health Framework 10 recommendations? We formed a recruitment. We did a onboarding with an assessment, asking questions that we're going to be doing as part of our activity today, just some of the open-ended, and we only included 1 or 2 under each, just to make sure that we're keeping it manageable. But otherwise, it was a really extensive assessment, asking questions about school policies, numbers, demographics, support systems, staffing, etc. We analyzed that data and we did focus groups during that first semester, fall 2018, asking students, faculty, and staff, what is your campus like? What do you think you need? How is mental health centered or not on your campuses? And we analyzed that data and gave it back and said, here's what we're seeing. Here's some summaries of what we found amongst your data and your focus groups. And from that, we asked schools to set their own goals and look at which of the recommendations did they want to focus on. Obviously, there's 10, so that's a lot. And some of them may have already been happening, but we asked schools to pick 3 to 5 that they really wanted to think about and consider and actually work on as a group. The next year we checked in, we asked, how are things going? What do you need? And some of the schools took up the opportunity to have the Steve Fund come and do some technical assistance and campus presentations and training. Some campuses even had coordinated joint training, like Western Michigan University and Kalamazoo got together and spent 2 days on these topics. So that was great to see that kind of collaboration and idea sharing among the schools. We thought that was really important. We completed the pilot back in the fall. So we analyzed the data. We're still working on the final data for individual schools, but we do have a report that we're proud to say we're going to be publishing very soon with our observations, the learnings, and hopefully when we get that out, you'll see some challenges along the way that we also had that can give some schools something to think about. So we'll start with the first one. I'll turn it over to Jan. Like I said, we didn't call them out before because we're going to do that here and tell you what we learned. So we're going to read the recommendations, let you know what our observations and learnings were. And this is preliminary information. Since the report's coming out soon, you'll see the full data then. And then we're going to ask an open-ended question that is on the activity sheet that you have.
Great. So the first one really is the overall, and we now consider that the overarching recommendation for the project. And how do you make mental health a priority, and how do students know it? And so to identify and promote mental health and well-being of students of color as a priority. And so next slide. Okay, so these were our observations from the results from the what campuses did, is that every institution did something. Every institution began to develop campus-wide practices, policies, but it was really individualized. This is why it's not a one size fits all. Some campuses were able to do some very extensive work. Some, making it a priority up to this point, have been doing background work and are ready to roll out initiatives. But however the campus approached this, it was consistent with their goals and with their objectives. Next slide. So our question for you would be, does your college or university campus-wide strategic plan, vision, or mission statement explicitly include the mental health and/or emotional well-being of students of color? This is interesting. We found that you will see that we know that making changes to the mission statement and strategic plan, that's big work. Some institutions are ready to do that. Some are ready to do it on a more smaller scale, departmental may include this. But the real trick is, how do students know that this work has been done?
And I see a question here, and I wrote back a question. It says, from Cheryl Portillo's, thank you for asking a question. Do you mean an example for number one and how that might work?
Yes.
Okay.
So for example, I'm thinking of one of the campuses that really worked on placing mental health and wellness as part of a huge goal for the whole campus. And then also included and are working on, how do you then, as if it's for the whole campus, how do you make students of color aware that they're part of this initiative? And so what that would be is then they have to break it down to, what do you see in social media? What do you see? How do you provide training on campus? How do you make sure that this is part of maybe on their website? So there are ways that the campus can certainly advertise and say, this is part of what we're doing. What does your leadership say? Is there a message from the president that can be very explicit, saying that we are concerned about the mental health and the mental health for our students of color. We certainly saw that after the killing of George Floyd, that there were campuses that had lots of statements. And now what students want is there's the statement, but what's the action behind the statement? So I hope that provides an example.
The example I think I can think of is, as a campus was working on their overall 5-year strategic plan, if they had a call out for diversity and inclusion, for example, that they didn't forget to tie it back to mental health and well-being, that it wasn't just about representation in numbers, that it wasn't just about creating special programs, but that some of those programs were connected to well-being and sourcing either diverse counselors and staff and looking at strategies that were helping marginalized student identities connect better to the campus and provide them with specific, I would say, wellness programs in general. So we have other examples we'll share later. This one's an overarching one. So it's about really, like Jan said, does the leadership call this out, say it out loud specifically, and not just say it out loud, but also put it in writing in their mission and in the strategic plans that you're working on your campuses.
And Cherie said she's really thrilled that this is not just focused on the counseling center that's overextended and doing the best it can just to meet the needs of students. This is really campus-wide, and this is the beauty of the equity and mental health framework. This really takes a community approach. It is a communal approach. It's a public health approach. It's an ecological approach. It is saying we're all in this together. This is not just a one-office deal.
But I do have to say that the campuses where there was leadership change, either a new president, new provost, new senior leaders, some of them worried or thought about, I wonder if what we're working on is going to be supported. Yeah. And to us, it was astounding, really, because if we're saying we want to create a safer and more welcoming environment for students of color, I can't imagine choosing a leader for your institution that wouldn't agree that that's a good idea, or that they would want to support it and fund it. If that wasn't happening, we found that that's when many of the different initiatives were breaking down or not happening the way that they planned or in the timeline that they were hoping.
Yes. Next.
So we're asking these questions as we go. We're hoping that you did download the document so you can start filling it in and kind of taking your own, making a copy of it so that you're not filling it in right here. So we'll keep moving to the next one.
All right. Is this yours or mine? I'm sorry.
No, it's okay. I'll take it. So the number 2, if number 1 was the overarching for the strategic plan, number 2 was pretty much asking students for their input, never building things that you're not asking the people that you're serving. So engage students to provide guidance and feedback on matters of student mental health and well-being, emotional well-being. So we encouraged institutions to look at their data. Sometimes it meant adding new surveys and data as part of the JED Campus program. For example, we do the Healthy Mind Survey. So many of you are familiar with it. And we're asking students directly, what are their attitudes, behaviors, and actions they take to take care of themselves, and what things have they experienced in terms of their mental health. So part of it is looking at the data that you have, either collecting new or compartmentalizing or disaggregating your data so that you get a real sense of what's happening on campus. And the previous presentation I went to, it was so clear that that was so important, because things that, if you look at an overall number, it seems like, oh, everything's fine in this area. But if you disaggregate, then you say, wow, there's something else happening here if the data is not as positive for some communities. So one of the observations we made, or a few, were that all institutions did collect data on student perceptions, behaviors, and attitudes. All of them did. They just had it in different places. So some, like I said, had the Acha-Nacha survey, some had HMS, some were doing other surveys that happened to have questions in them that were those national surveys that many campuses participate in yearly. But what was happening is maybe they weren't looking at it. So this gave them a nudge to really look at that data and not just look at it, but figure out how to use it and how to incorporate it into your strategic planning and your action steps moving forward. So this is the open-ended question for you that's in the activity sheet. Which of the following actions has your college or university taken to help improve your campus climate for students of color within the last 3 years? So this is one of many questions, like we said, from the assessment. Did you conduct a campus climate survey? Did you increase the diversity of the faculty? Did you increase the diversity of the student body? What other things did you do to improve and find out back from students if they were having a positive experiences on their campuses? So we'll give a few minutes, and if you have any questions or thoughts or comments, we'd love to hear them. And we'll come back at the end to spend even more time for you to be answering these questions. So we want to move through to make sure that you can know what we're saying under each one as you do the activity.
And we'll be asking for your responses and your thoughts.
And this one we mentioned before. Recommendation number 3 is actively recruit, train, and retain a diverse and culturally competent faculty and professional staff. Part of this for us is not so much, yes, I think the faculty staff need to represent the students you serve. That is so important. That study after study shows that when students see themselves in the leadership even, that they feel really much more positive about their own life on campus. So we strongly encourage that that's part of a plan and a strategic plan, that if you're not there yet and you don't have diverse, for example, counselors in the counseling center, that you're thinking about what other ways can you connect. And last year with COVID, I think there was a lot more open access to health and other means. So there was opportunity to add more representation on the counseling staff, especially. But we're not only talking about the counseling staff, and we're not only talking about recruiting diverse faculty, staff, and administrators. The word train is there too. Everyone should be able to serve every student. There shouldn't be a reason. And I was in higher ed for 24 years before I came to the JED Foundation in this role. And one thing I found always interesting is that as a woman of color, I'm Latina, people would send students to me whenever they felt like a student was struggling or having an issue. And that was fine. And of course, I'm there to help every student. My last role was an associate vice president and dean of students. But I also felt like people should take it upon themselves to get to know students for who they are and provide the support no matter who they are. There shouldn't be just some people on campus who get students of color referred to, because that's heavy on many staff members of color, especially. So I wanted to make sure I point that role. And we did find that many campuses had really good intentions. Of course, COVID caused many financial and budgetary constraints where staff were being furloughed even, or not returned if they were on contracts. And we understand that. That is completely understandable under these circumstances. But I think then if you can't hire new staff, I think the focus then becomes, how do you make sure that your staff that you currently have and your faculty that you currently have are culturally responsive, culturally competent, and are able to help any student and not think, let me think who can possibly help. Unless it's a specific identity related issue, anyone should be able and see themselves as a support system for all students.
Before you move on, the other piece of this that we learned from students is, how will they know that you had this training? What is it? How does that show up? What is it that you can say, you can post? What is it you can do to say, this center, this service, this department has had culturally competent training? It's a sense of accountability also for everyone.
And I see a comment here. Thank you, Alyssa. We recognize that our wellness staff is not representative of many groups on campus. We began using my SSP to help bridge gaps for BIPOC, international students, etc. That's wonderful. And someone else said, and being hired doesn't translate to being supported. Yeah, we can have a whole separate session about the faculty and staff that we spoke to in this process who shared with us some of the struggles they had. They were trying to be helpful and supportive, but they didn't feel supported themselves. And it's really hard to help others when you're feeling not connected to the institution yourself. How do you put on a really brave face and a positive face when you're not getting that kind of support? So that's a tough one. And like I said, we could spend a whole another hour or more talking about that. So the question here in the activity sheet, if you want to go back to it, and we'll give you a few minutes, is what steps has your institution taken to increase recruitment and retention of racially diverse faculty and staff? Did you examine and address common challenges with tenure and permanent status processes, those contracts, like I said? Conducted exit surveys with faculty and staff to better understand the experiences that they were having on campus, especially staff and faculty of color? Did you use that information from climate surveys to address issues that affect retention of racially diverse faculty and staff? Did you support affinity groups to promote community and belonging among faculty and staff of color? It was so clear that students can see it. They name all the faculty and staff on some of the campuses that we were working with that were historically white campuses. There were students who said, oh, in 1 year, we lost this one, this one, this one. They can name them one after another. So even though the retention numbers compared to everyone else might be smaller and it may not seem significant because it's only 2 or 3 people, to students, those 2 or 3 people are their world. And that shouldn't be. I think it's great that they see themselves in those staff and faculty, but also they really need to feel like there's a support network for the people who are supporting them. So we'll give a few minutes here for you to kind of think these through and take some notes in the worksheet for these.
I would like to add that as you begin to implement these recommendations, it's not just the students that need support, but it's the faculty and staff of color that need support. And it's a mutually supportive framework. And as you make mental health a priority for students of color, then other issues become a priority for students of color also. So it is not an isolated entity. It's not an isolated issue. It's all interconnected.
So we hope you're taking a few minutes to fill them out.
Okay.
So we'll go into this next one.
Okay. You ready? I'm ready?
Yep.
Okay. We want to create, so the next recommendation is to create opportunities to engage around national and international issues and events. Well, certainly when this was developed, it was pre-COVID and pre a lot of issues. So we have Black Lives Matter, we have so many issues around social justice and racial injustice that there was plenty of opportunities for campuses to create these forums and to create events and ways for students to connect, to learn, to share, to really get a handle on what is happening, current events externally and internally. It will reflect internally on campus also. We found that the institutions that provided these opportunities for students were less angry. And I'm going to say that again. So the institutions that provided opportunities for students to discuss national and international events, inform and supportive spaces, in person and virtually, were less critical and less angry at the institution, not at the event and the social circumstances, but feeling supported, feeling heard, and feeling seen by the institution promoted better mental health. But feeling isolated, devalued, and ignored, really, we saw on campuses where the students felt totally separated, disengaged, and said this impacted their mental health. So the campuses that had, I want to say, authentic messaging from leadership, starting with leadership, authentic and extensive, and I would say over communicating, in other words, sustainable and repetitive messaging was really important for students to, again, feel that they belonged and valued, and that the institution reflects them and is there for them as they are for other students. In addition, we've had students that said, well, you know, we got these messages, but they're always the same messages. And that's why I put in authentic. So the question for you is, does your institution create these supportive spaces and forums for students, faculty, staff, and community members? It's not just students, right? To come together to respond in an impactful way. I was the senior associate dean at Pomona College. And when Trump was elected, our campus sort of came to a standstill. But the one thing that happened was everyone at the college, there was a really community space and a communal response. And the institution continued to say, we are here for you. We are going to work together. We are going to figure this out together. And that was such a positive, there was such a positive response to that. And students did feel supported. It didn't make the situation easier, but they felt that they were not out there by themselves. Okay, I think we can go to the next one.
So this is the open-ended question in the worksheet. Does your institution create these forums? So what are some examples? We definitely want to hear those examples because there might be some ideas that you could share with others. One thing that we learned with remote learning, geography was no longer a thing. I mean, anything happening anywhere was impacting all of our students, our faculty, our staff. So many forums had to be moved to remote or otherwise, you know, whether it was chats. I heard about students who created their own group me's around different topics and were able to engage and have just a lifeline almost of people they could just turn to as things were happening or as they were watching the news. So there's a lot of ways that we can help foster those things and create those opportunities for students to engage even more. So we'll give you a minute to continue. We hope that you're following along with us and filling these out. So recommendation number 5 hits home for me since I've held a role like this in several places. Create a dedicated role to support well-being and success of students of color. So one thing I would say is that while it was clear that many campuses have figured this out already and have already had positions like this, many were in offices like the EOP, EOF, opportunity programs. Some of them were created as in conjunction with international student offices. Some of them were located in STEP programs, STEM programs, or other academically connected programs. But either way, these were all positions who just seemed to really know how to outreach to students in the ways that students needed most. But one thing we did find, our finding here was there were offices that existed, cultural centers, DEI offices. There was no shortage of that. The shortage was support, again, for the staff, where they were a one-person office many times and had a very small budgets or did not have any kind of administrative support to handle some of the and other things that needed to help facilitate the ways that they were trying to engage with students and bring them together. So institutions have implemented a variety of programs and strategies to support students of color. But again, we found that these roles were exhausted. Not only were they impacted by their own racial trauma and their own racial battle fatigue, and I know I'm throwing around a lot of terms there, these are the terms that we heard throughout the process from dedicated roles like directors of multicultural affairs or assistant dean for diversity and inclusion or other offices that were designated to be support systems for students of color or LGBTQ plus students. They were exhausted last year. So if there's anything that we learned from that, is that it just cannot be one office. It needs to be a campus-wide comprehensive approach to handling anybody who needs additional support in any way. So our open-ended question here for you to answer is, does your campus have a designee responsible for campus diversity efforts? Describe how students are educated about these support services and offices. And I want to offer that on some campuses, there's been an expansion of, yes, these are subject matter experts in the area of diversity and inclusion, but they're a support system for all students. But they do have research and very specific training around support systems for marginalized identities. And if they are collaborating with others, it's even stronger. It's a stronger office. So that's something to consider. When's the last time you checked in with your folks on your campus that are your multicultural affairs or diversity inclusion offices? Have you checked in on them? Have you asked them how they're doing? Have you asked them, can I help you? Do you have any support systems that you can offer? So we'll leave it there while you answer this question. But usually we found that these offices did exist.
I'd like to just add a thought as you're moving along with your and filling out your form. We also found that this is where students went for mental health support, because these are the safe spaces. These are the spaces where they found people that looked like them, had the same values, part of their community. And so these spaces are, some had embedded mental health within these spaces, but these are the staff that were really directly impacted by COVID, by all that happened in terms of the racial injustice in the spring. And so so some institutions then embedded counselors in there. That's not a new concept, but what really is significant is the impact this had on the staff.
And thank you for your comments. I see Esmeralda Trevino, I, as well as peers, have been hindered in creating services for students of color by the very staff that were supposed to help us. I'm sorry to hear that. So not only hiring a diverse staff, but hiring a diverse staff to actually care about the issues at hand. I think that is important. And Andrea Hill, regular town halls have been helpful in our department. We have held town halls regarding sexual misconduct, police violence and protest, election stress, and pandemic fatigue and burnout. That is real. Also, weekly check-in surveys have helped student support staff reach out to students who are struggling. That is really excellent. I think it's ongoing. Now we can't wait anymore until that survey once a year, because so much is happening so quickly. So I really appreciate that you're trying to just really let students know we're listening, we're responding, and we want to be able to support you when you need it. And I see Andrea Fierro said, we have seen a downturn in engagement from students in our space. Many campuses are experiencing that. It seems we are up against Zoom fatigue from our students as well. As a staff member, this has created great stress in how to support our most vulnerable students. I definitely feel that. We all feel, online fatigue, but we're trying to figure out how to better engage and maybe thinking outside the box a little bit and calling students on their phones. I know students are terrified when we call them, but I think finding other ways. I have a couple of teenagers, so I know this. But finding alternative ways to meet. Sometimes, if you say, I'm going to call you instead, is that okay? Instead of trying to set up Zoom meetings all the time, I'm trying to do that more myself. I think they're now more open to that and are like, okay, yeah, as long as I don't have to see a screen or have to, do my hair even, that's definitely real. So we'll move on to the next one.
Next one is to support and promote accessible, safe communication with campus administration and an effective response system. This really does address bias incidents, racial hate incidents, incidents that students really need a safe space to quickly communicate about issues that are concern to them, and then also how the campus responds to that. And so what are your systems? Who responds? Is it confidential? Is it quick? What does it support, and does it provide a way and a space for students to feel that they are supported and heard and listened to? So next slide. We had campuses that have had racial incidents occur, and because they have had good systems to respond, it doesn't mean that it made the campus safer. Let me rephrase that. It doesn't mean that it made the campus less vulnerable to these incidents, but it does mean that the student or the student groups itself were responded to right away, and that is really important, and responded to in a relevant and an authentic way. The other, and some of you may use Simplicity, some of you may use Maxion, some of you may have developed your own systems, but it needs to be confidential. It must be confidential, and it needs to be quick and responsive. We talked in the previous recommendation, and you can see how these build on each other, that the communication between students and staff and cultural centers and student affairs offices is was supportive overall. Students really felt that very much. And then also we had examples where DEI offices are assisting in outreach and assisting in counseling centers to really find the most relevant and the most efficient way to reach out to students and staff and faculty of color.
And I think that's a way to support those incidents that for some public safety officers may not rise to the level of a hate crime, but that doesn't mean they're any less traumatic for students when they're encountering things that when they go to the public safety or campus police, they're like, well, I don't know if we're going to even write that down because it doesn't seem like a big deal. It's just a microaggression. But if you find ways to let students still make reports, even if we're not sure if it's going to go anywhere or they don't have a name or it's anonymous, I think it's still a good way to get a pattern going on your campus of what's happening. Because I have seen where a public safety officer was following protocol and would say to a student, oh, well, that's, you don't have a name? Okay, we don't want to write it down, because it seemed like it didn't rise to a hate crime exactly, but it still was enough to jar a student if it was something that they observed or something that they weren't sure. So then students start using language like being gaslighted or being dismissed. So that's when those communications between your campus law enforcement, public safety, campus police, diversity offices, and counseling offices can work really closely to create those that sensitivity to the way that issues are happening and incidents that are happening that are not, again, rising to what someone would call a hate crime.
And I would like to include in here the Dean of Students Office. I hope you hear how we're talking about multiple offices, multiple campus stakeholders coming together to create a system, a safety net of care, a safety net of attention in making mental health a priority. This, again, it is not just the purview of the counseling center. It really is so many offices talking together, thinking out loud, supporting each other, and sharing resources to help make things happen. Because the other piece of this, what are the financial resources? But if you can collaborate together, then you can share that. And the burden, again, is not in one space or one place.
Exactly. So the open-ended question here for you are there published policies and conduct codes that clearly state expectations for conduct for faculty, staff, and students, and directly states the school's policy and procedure for protecting the rights and well-being of all students? Yes or no? And if yes, we hope it's yes. Are these policies published in easy to access places for faculty, staff, and students? And I would add to this, is there a procedure for handling things as they come in? And is it clear? Do students, faculty, and staff on your campuses, especially students, know what happens next when they make a report and when they submit information to be handled? So we'll leave a few minutes for you to answer this and think of any other ideas. And thank you, Cheryl Pertuz, about case management offices. I absolutely think that they are critical to campuses, especially right now. When I was at Hofstra, we co-created one of the first positions there that was a case manager, student advocacy position, because we thought it was something of a, not exactly counseling, not exactly the dean of students office in terms of conduct, but it was a support system. It was supposed to be a position that connected all the dots around campus to make sure that each student got what they needed and was outreached in the way that made the most sense and from the person that made the most sense.
So I'm looking at time. And so if we want to get responses, we're going to need to keep moving. And so offer a range of supportive programs and services in varied format. And this is where campuses were very creative and did so many different ways. And I mean, really thought of some really unique ways to reach students, to have these culturally relevant programs. We also found this is a point where curricular infusion also happens. So how do you bring faculty into the picture? One campus, it was the faculty that led the way in talking to students about their mental health and supported the counseling center. So they started and reached out rather than the counseling center reaching out to the faculty. And so it was a wonderful, wonderful relationship that students saw and responded to. And that's really the key. We do so much work behind the scenes, but yet how do students see it and respond to it? And so that's always a accountability point. Next slide. So the questions are, do you provide support and programming? And so we have a whole menu here of ways to provide programming for our students that really focuses on the intersectionality of students of color. And so this is how it breaks down and expands. I'd rather say breaks down, but it really expands to different points in the student's life where they connect with us. All right, next slide.
And this one became extra salient in this past year. Yeah. The first year, the conversations were, this one is help students learn, number 8, help students learn about programs and services by advertising and promoting through multiple channels. As we know, if you ask students, how do you want to be reached? They'll say, oh, just email me. And then they don't check the email. So we're like, okay, do we text? Do we put messages in one place that students will look? There's very creative, different ways. But in the last year, especially, I think many offices were challenged with how to create different channels to communicate what these services and programs were. But I think it's getting better with a lot of management systems, online systems that are able to really hone in on different identities for students and different ways that students normally engage so that they can be very targeted and very specific about how they're outreaching. At least the last time when I was at Hofstra, there were systems we were putting in place to help students get messaging at just the right times or by proximity, which I think changed obviously for the online and remote learning, but nevertheless, making sure that you are thinking about that. Who is this serving? Who's looking at these messages? What is the right word of mouth or other ways to get information out? So campus-wide messaging, what we found that addressed issues of diversity and inclusion often emerged as a result of specific campus incidents. That's usually around the time that students saw more of a voice from their leaders, especially during national unrest. One thing we want to say about the channels is that students want to know that they're being cared for and focused on all the time, and not only when issues are happening. So that was another observation that we made, that it's important to have a strong voice as a campus on what it is that you stand for and what are the issues that you will address with students and not just for them. So the question here is, which of the following do you do to effectively promote programs and services to students? So obviously there's lots of ideas here, so we'll spend some time on it. Is there specific funding? Is there a time and staff dedicated to marketing of programs and services? Do you advertise early? I think sometimes advertising right before events is actually effective sometimes. Do you advertise multiple times? Do you get them out in different ways? And this was part of the survey that was early on 2 years ago, so we could have imagined how much some of these would become relevant now. And some of the programming locations would be virtual. And many of our campuses that we worked with were able to successfully move a lot of their programs to online forums. And I think especially affinity groups where, for example, one campus had a support group for women of color who got together in person, and they found that when they moved it remote and online, more people were able to engage because people who weren't able to join before because they were working or had projects or other people to care for at home were now able to be part of that and include their family and their support systems even within their home. So we think some of those will continue, but that's definitely ways that different channels are in play here. And this one's very similar to the previous one, number 7.
Okay, so we're going to move to recommendation 9 and identify and utilize culturally relevant, promising programs. So in other words, are you doing your homework? And are you looking for best practices and really gathering information from our higher education community, and to see, just like coming to this conference here, to see what are other campuses doing, what are other institutions doing to best meet the needs. And so it really is just, again, I would say doing your homework and looking at what is it that your benchmark even institutions are doing. So the questions for this one is, next slide, is how does your institution assess programming targeted for students of color, and how are you adding and making sure that your programs are up to date and relevant? Next recommendation.
So thank you for hanging in there with us. We went through all of them, but this is number 10, and we think this is one of the most important ones and why you're here.
Yeah.
Participate in resource and information sharing within and between schools. There's so many great programs that are happening, but sometimes you don't reach out to other campuses because you're like, maybe that's not going to work here. But I believe in promising practices, maybe not best, because something best here might not work there, but sharing information about those strategies and programs you're doing is really important. And what we found is that institutions did share information across campuses regarding issues affecting students of color. So they had formal interdisciplinary task forces. They shared, even amongst our group, they shared agendas, they shared talking points, they shared different ideas that maybe you may not have thought about or thought might not work, but others did try it. So there were partnerships with student leaders and student organizations that we saw. There were accountability measures like regular reports to campus stakeholders. So we found that this one was a really important one because even on campuses, there were offices that were, we always hear, well, offices work in silos. But one thing that happened with some of the campuses we worked with is that they started working together with other offices and found, oh, we're all here doing the same thing. We should share resources. It doesn't have to be a competition. It could be a collaboration instead. So the campuses that had the most collaboration across campus were the ones where we saw the least amount of student complaints or student concerns about whether or not the campus cared about them or about whether or not the campuses wanted them to be successful. So it was very clear that once students got a whiff of that shared collaboration and shared care, that was really important and stood out to us a lot. So the last question that we have in the worksheet is, how does your institution currently share information across campus regarding issues affecting students of color? So are there task forces? Do you partner with student leaders? Are there regular reports? So everything we mentioned before, and is there a formal process to do this so that there is accountability and it's not just a one-off whenever something happens or there's an emergency or an issue or incident? Is this just part of your campus communication that you're sharing amongst each other? What's working in different areas, in different disciplines? Because there might be something even academic departments doing that is making students feel really connected, and maybe those ideas can be translated to other departments.
All right, so now we've done a lot of talking, and we would love to hear some of the answers to your questions that you were able in your reflections. And the point of this is taking note of each of the recommendations, thinking about your campus, and then figuring out what recommendation do you think your campus needs right now? And based on that, what would you think about that would be the change or improvement that you can make? What do you need to do to make it? And then break it down to a project that you can assess and evaluate its effectiveness and continue to work and build champions around the actual work of transformation. So would love to hear what your thoughts were as we went through the recommendations. We're happy. You can actually, if I'm right, Sofia, you can speak or you can actually write. Am I right? They can.
And this is what I'll ask our moderators to help us. If anyone raise their hand and want to share, I'm not sure how to have them come in. So please either put your thoughts in the chat or go ahead and unmute yourself so that you can ask questions or share some of the things that you thought about that came up as you were filling this out.
So all you do is click on the blue button in your upper right-hand corner of the presentation screen.
So hopefully, many of you have been answering the questions all along. So some of the questions from us to you is, were there any in particular from the 10 recommendations and the questions accompanying that were difficult to answer? If so, why? Were there any that you felt really good about it? You're like, oh yeah, we got this. This is one that our campus has really focused on. Either way, we'd love to hear from you and see what came up for you as you were filling out this activity. And I see Amy Lowe, thank you for your comment. I agree this idea is valuable. I'm at a small school with more limited resources, but modeling policies and practices after larger state institutions is very useful. Also, more directly, we're implementing a financial emergency assistance program based off a program at a different community college. That is really great. And sometimes you can shortcut it because they already have a policy written up. Many campuses have worked towards that, have created a committee, and you can just borrow from the language and see if it works for yours, so you don't have to recreate everything. I'm in the really big business of not recreating things if you don't have to, but making it fit for your campus. And Alyssa Lusky says, I think that my institution has made a lot of progress in many of these areas these past years with new leadership. That's great to hear. And Lee White says, hi, Jen and Sophia. Hi, Lee. Nice to see you. So do you have any, I think this is a good time to think about the next one, which is to consider which recommendation, if you think there is one that you wanted to focus on more. We also want to hear your questions. Lisa Thomas says, concept around safe spaces. Oh, I'm sorry, Deidre, you want to say something? And then we'll come back to Lisa's comment.
I would love to. Thank you so much for the information that you've been sharing already. Learned a lot, but I think where I noticed from our institution where the questions got a little more challenging was where it came to communication, cross-campus, leadership down to other units and departments. That's where the questions became more challenging. I would believe that there is communication, but I am often experiencing a struggle that it's not getting down to some of our areas. I'm director of the counseling services, and oftentimes I don't feel like I'm getting some of that information, even though it's being talked about on campus. So that was what I experienced as we went through this presentation.
So
are you saying sorry, go ahead, Jen.
Yeah, I'd like to respond to that as a former counseling center director, that you know, it's an interesting position and space. Think about that the counseling center is a different space, and a lot of times you don't have a lot of information, but the real impetus is what kind of collaborations can you begin to establish so that you really are in the room, in the table. You know, the Hamilton said, we're going to be in the room at the table. And part of that is just taking, you know, literally taking over and saying, we need to have more collaborations. We need to, you know, work together. I need you, you need me to work together because we want to make mental health a priority. And so there's some easy offices to begin to really collaborate with. One is academic advising and just figuring out about academic success. And, you know, that's really sort of a no-brainer when we see so many students that come into the counseling center struggling, and it really impacts their mental health, which impacts their academic success. And so that's one of those areas that you can think of, or identify within your campus, who are the folks that are getting the information and how can we work together so you're really in the room at the table.
Yeah, I think, thank you, Jan. What we've experienced is that within the student support services area on our campus, there's a lot of collaboration, and we collaborate with our Office of Multicultural Student Affairs probably the most out of anything. Oftentimes, I think some of these discussions going on at the leadership level are the ones that are not coming back down. And I see some of the comments in the chat where you're talking about maybe where a director or where a specific staff person should be sitting in which committees and which maybe task force or work groups. And I think that's the COVID-19 has allowed us the opportunity to push mental health on campus because no one can ignore it at this point. So it is allowing us a little bit more latitude, but I know in answering the questions, I'd have to really go back and talk to my supervisor, get feedback from vice chancellors, like who's doing what, where are they doing it, things like that.
Well, if you see at the very bottom of that worksheet, you could figure out which recommendation that you would just begin to chip away at, little by little. And so that you could understand and your staff would know what's going on, because you'll find out eventually when students come in to see you. And so, you know, that would be my recommendation. But also figure out who's at the table that you can have an easy collaboration with.
Okay.
At that level. I was just looking at Lee White's comment and at Michigan State, and what they're doing is partnering with the chief diversity officer. I would like to, particularly when we're talking about students of color, the chief diversity officer and that office is your friend, because they are there to make sure about the retention and the well-being of students, faculty, and staff of color. Absolutely. And so that's a natural alliance. And I'm going to let Sofia talk about that as a former DEI VP.
Yeah, thank you so much.
Yeah. Thank you so much, Deidre. I'm glad that you joined us. And we do have a few other comments I see here, but one response I have is that whenever I see a campus create a chief diversity and inclusion officer or vice president of diversity and inclusion, I think it's great, but I think it's one part of the bigger picture. And that position is designed to be a strategic thinker with everyone and to be a resource and to really coordinate a lot of different things happening on campus. But that should not let anyone off the hook. And I see a comment here where someone said, I'm glad that you're talking about senior leadership in all of this. And that was Alyssa Lusky. Thank you for that. Because yes, you are correct. When you're talking about adding resources and just general care for students on campus that are not usually seeing themselves as if they belong to campuses, that message of everyone belongs and everyone should be here needs to come from the top. But that also comes with resource sharing and allocation that provides targeted, or I don't always like the word targeted, but focused support and additional information shared with people for training, for development, to understand what your words mean. Earlier, somebody said something about the terminology we use and the language matters. Yes, that is true. And that's why when you do add a diversity and inclusion person, that person doesn't know everything. I'm a chief diversity and inclusion officer now, and last year was a tough one. We were adding language, even as professional diversity and inclusion folks, we were adding language to our very own training and development vocabulary that we were not used to using just regularly. For example, BIPOC was a newer term that even within my own at JED, I was working through what's the right definition for that? What does it mean? Where does it come from? Why are we now using BIPOC, Black, Indigenous, and people of color instead of students of color or people of color? That was a conversation. Why are we now talking more actively about anti-racism? That was a new conversation, because if it wasn't part of your vocabulary or your statements before, now it is, because other people have started using it too and figuring out the conversation around what that means, what it actually means. We also were using terminology like white supremacy. As a diversity trainer for over 20 years, I was very careful with that term because I knew where it hits in different places is not always the same. So just saying that this is a lot of thought work and research work and just keeping track of all the different trends. And that's a job in itself. So if you're on top of that, scheduling meetings and doing coordination with different offices all over campuses, I urge you, cut that position some slack and help them with whatever you could do, whether it's scheduling meetings or other tasky things, so that the thought leadership there can really stay intact and that person can stay on that resource development side of things and really the strategic thinking and really shepherding everyone through the different knowledge that you need for your campus. So that's my pitch there. I'll say that, but I want to respond to Lisa had said the concept around safe spaces has been something we had to really think about during the pandemic. That's right. We have to rethink what space means. Is it virtual too? I say yes, and it's here to stay. And it always was there. Students were creating groups for each other. One of the schools that we worked with through the Equity Mental Framework cohort, students of color created their own WhatsApp group or group meets on several campuses. I've seen this, where as soon as they see someone on campus who's a student of color, they're like, oh, you need to be in this group. And they create a network for themselves. But what also happens is when one student shares an incident that they had or an interaction, a negative interaction that they felt was racist, guess what happened? Everyone in that group got involved and knew about it immediately. So what does that say about, you can have your own systems in place, but students, the network that students have amongst themselves and the spaces they create, back to the idea of spaces, is nothing like what we can try to do for them. So we have to kind of work hand in hand and really stay in touch with what that means to students and change things accordingly or support them accordingly.
I'd like to ask, again, we talked about a recommendation that you feel would be really relevant to your campus. Would anybody be willing to share that?
I think people are being shy, but that's okay. We hope that this process gave you some time to reflect. Emily Ribnick shared that their flagship campus did a call out from the provost office to academic departments to find out what they're doing connected to mental health and wellness. That is excellent because
Yes.
like I said, some departments have figured it out and really know how to do it. Some just don't know what to do. So they might get ideas from each other. So I don't know if you want to speak to that, Jan, of how to share that info with each other.
Well, again, I'm going to talk about how to, so let me just talk to you from my experience for a minute. So as a counseling center director and then working in the Dean of Students and being an interim Dean of Students, it became really clear to me how isolated and how siloed offices can get, particularly when discussing or addressing students with mental health issues. And breaking that down is a real challenge. However, by coming together on a regular basis and just doing, somebody was talking about a case management, having case management discussions together, if you have your care team or bid team coming together and then using that forum to talk about programming, using that forum to talk about prevention, and using that forum as a model for other forums to work together, not just to talk about a student who's having issues and are, in trouble. So when you can do that, and Sofia said it, those are the campuses where we saw our students do the best, and our students really see and feel supported and know that the campus is really working at, because nobody has succeeded. Nobody could say 100%, this is it, because it is ongoing. It is ongoing because our world keeps changing, issues keep changing, but our students see that this campus, I have a sense of belonging at, they care about me, and we are moving forward to trying to make mental health a priority.
So for the last few minutes, we'll answer any questions you have. I think we've shared a lot, and we can share the slides if you would like to see some of these. So we're happy to do that. Is there any other idea, question, or something that you saw or observed during this presentation that you're interested in learning more about? So we're excited. The report is coming out soon, and you'll see some more of our learnings and observations throughout the pilot implementation. And partnering with Jan Collins-Eaglin has been a pleasure and a treat. It's
likewise. We have learned from each other. Yes, I'm so glad the worksheet is helpful. It was not meant to be filled out completely. It is an ongoing process. It's just an ongoing guide, just to think about where your institution and what is it that you can do within your own sphere of influence. Thank you.
Thank you so much. Feel free to contact us if you have any questions about either of our organizations or anything that we shared today. Thank you so much.
Thank you.